welcome to our episode 3 of the GenNext Community Talk Series. I'm Farron Mather, the Engagement Manager with United Way Central Alberta, and today we are going to be talking with the Turning Point Society. We have one of our GenNext members, Sean Enright from RBC, and Aisley Miles, the Program Manager from Turning Point. So I'm going to pass it on to Sean, who's going to continue the conversation with Aisley, and yeah, everybody enjoy.
A little bit about GenNext for those that don't know. We're part of the United Way of Central Alberta, a group of millennials that are really just trying to raise awareness and about local issues that affect our community and try to get our peers involved with the United Way and other great organizations out there. And Aisley, you're one of those organizations that are affected by the COVID crisis. We're recording this on May 8th. It's hard to believe now that it's been 4 months since COVID-19's been in the news. More recently, 4 weeks really since it's been affecting Central Alberta. The United Way introduced a community response fund 4 weeks ago, exactly today. I think it's great that over $100,000 has been raised by community members specifically to this fund to get money out to organizations as fast as possible. I know $100,000 definitely didn't go to each organization, and more money is needed. However, I wanted to start by thanking all the donors that did donate so far and encourage people to visit the website to find out more. But with that, we're here to learn more about one of the organization's Turning Point. So I'll turn it over to you, Aisley, to introduce Turning Point in Central Alberta.
Yeah, so I'm the program manager at Turning Point. We're known as the Turning Point Society of Central Alberta. We used to be known as the Central Alberta AIDS Network Society. It's been around since 1988, so a long time. Been doing harm reduction since 1998. And yeah, we changed our name a few years ago just to reflect the fact that we're not just doing HIV work anymore. And we've expanded a lot of our programs. So.
United Way GenNext came up with some questions as a group that we wanted to ask specifically to find out more about how you're addressing the crisis in COVID-19. But first, I wanted to start just with some general information about what clients you guys serve in town and which community members are most helped by your services.
Okay, yeah, we help a wide variety of people. Anyone from someone who uses drugs or is experiencing homelessness. We work with people who are LGBTQ2SIA+, people living with HIV, people involved in sex work, and then women of reproductive age, and also people in rural communities.
Give us a summary of what programs you offer here in Central.
Definitely. So we have a rural outreach program, which is actually funded by United Way. And we have 2 rural outreach workers that go to all of the Central Health Zone communities and just provide rural outreach there. So that mostly is community capacity building around HIV and related issues. We have a harm reduction program, which is our largest program, which includes harm reduction, supply distribution, education, the overdose prevention program, and much, much more than that. We have our women's program, which works with women of reproductive age and all things related to their sexual health. It's based off the Her Pregnancy program in Edmonton, so if you guys ever want to check it out, just search it. We have our health promotion program, which works with people living with HIV and or Hep C. We have an overdose prevention program, which educates and about naloxone and distributes as well. Our night reach program is a team of 2 that walks around with red backpacks in the evening in downtown Red Deer. Oh, I think I covered them all.
Yeah, the night reach program is probably one of the more visible ones out there. I'm sure many people have noticed them walking around and might have wondered what they're up to. So that's you guys.
Yeah, definitely.
I actually, a few months ago, before all this happened, I came into Turning Point and did the naloxone training, and it was so impactful. I loved being a part of it and learning how to use it if I were to ever need to. Hopefully not, but I thought that was a great service that you guys provided.
Yeah, and we do offer the program or the training to anyone in the central zone through drug trends presentation. So if anyone's interested, they can just contact our office.
Awesome.
And it's free of charge.
It's a great service and keeps emergency rooms less busy at the same time, right?
Definitely, yeah, emergency and a medical, medical transportation and stuff.
Can you talk more about specifically COVID-19, how that's affected the vulnerable people that you help, and what's changed in the recent month?
Yeah, I can definitely talk about that. So COVID-19 has been a transitional period, to say the least. I do believe we've had our doors closed for over a month now to the public, so that's been a huge change for us. We've never had to do this in the past before. We are serving people from our front steps, wearing the proper PPE and just trying to maintain social distancing while we do so. So that's kind of what we have put in place. And then, of course, wearing PPE while we're in the office and trying to maintain social distance from each other in the office as we go about our days. But as far as how the clients have been impacted, I think that's the most important part is that they had limited access to services prior to this, and it's just been exacerbated by COVID. So things that people I feel wouldn't normally think of, like access to a phone or internet so that they can access supports that are available from the government. So that's a thing. And then public bathrooms, there's only really one place that they can go to the bathroom right now, and that's at the shelter. Yeah, showers, stuff like that. So even transportation is limited. I mean, our women's program transports their or can transport their clients, but they can't at the moment because of COVID. So they haven't really been able to, a lot of the women's program clients haven't been able to access that service since this all started as well. And there's been definitely increased feelings of isolation from the participants in those programs because they can't stay connected to the services that they're used to being connected to. So,
Wow. Uh, one of the things we've been getting questions about is, and from people we're talking to, is what if you're someone that wants to help out, might not be able to donate to the fund, but what could you do, right? Do you see any opportunities out there for people to help besides donating money?
I do know that there's been a lot of places trying to move to virtual volunteering. So it might be worthwhile checking that out online if they have access to a computer with internet. Some places do offer that. Unfortunately, we don't have anything like that. Um, but helping out if they can't donate, I feel like just being more active in your community as a whole would be a start, or just doing good deeds for other people if someone needs help with like errands and stuff, or picking up garbage. That's always a plus. But yeah, and then as far as like donations that we can take that are maybe not like a monetary thing would be clothing. We do have requests for clothing, so if anyone's interested in donating clothing, they can contact the office and see what we need. And then we always need things like toiletries and snacks and stuff. So yeah.
And has your the volumes of people you serve in their community, has it increased in this time?
A lot of our same clients are still accessing services through us. If people are housed, we're trying our best to either do contactless delivery for supplies to them so that they don't have to come down to the office. We can mail packages to people right now too. And then we have been seeing an increase in people that don't normally access service, but they're accessing so that they can, they're coming to us to access food, not necessarily supplies, just snacks and stuff. So we are seeing an increase in that. But other than that, it's, I think, normal for us. We're maintaining anyways the normal amount of contacts we have in a day.
I'm interested about how, with those doors closed now, how, if you're seeing a negative impact on that, or how it's affected your services, since that's such a big portion of what you do, and allowing them to come through those doors and talk to you. And so I was just curious how that has impacted people.
Yeah, so I think the biggest impact would be that we can't have those more in-depth, meaningful conversations with people, or there isn't necessarily a safe space where they can come in and kind of decompress with us, because there is no real anonymity when helping people from the front door like we are. Like, anyone can just walk up while they're standing there and talking to us. I mean, staff could go outside and stand like a certain distance away from them and have a conversation, but it's not the same, definitely. So I think that's one of the major impacts, is not really having a safe space to go to talk or to gain additional resources that they might not be comfortable talking about, like at the front step. So and then also, like, those more in-depth conversations about maybe someone had responded to an overdose and it was really traumatic, and now they don't have the space to talk to one of our staff about that, and they're just carrying that around with them. So yeah.
How do you see, as the transition, as we go back into what our normal was, not sure how long that will take. Are you are you expecting any changes with how you run your services or your programs?
This is something that Stacy had asked us all to think about moving forward, so that we can prepare ourselves for what that's going to look like. And we haven't really come up with any permanent solutions to move forward with yet. We're still kind of talking about it. We did try, when this all first started, to keep a limited number of people in the building, and only like try and get so we could clean the bathroom in between each person. And there were so many people wanting to come into the building that it was just hard to do it in a good and safe way. So that's why we had decided originally to shut the doors. So I think it's mostly going to be about trying to see if we can find a way to meet in the middle where we can let a certain number of people in, but we need to figure out how to get them through in a timely manner, if that makes sense. And which is unfortunate, because people sometimes just come to hang out and have a cup of coffee and stuff, and I don't think we'll be able to offer that in the beginning until things are back to normal. So yeah, it's kind of all still up in the air, but we're working on it. So.
And if people would like to learn more about Turning Point, where's the best place to go?
We just got our new and improved website up and running like last fall, so that's pretty exciting. We have a Facebook page that's pretty active. It's just like Turning Point, and it has, I think, a purple picture that says I support SCS. We have Twitter and Instagram, and then if they want more information, they can always call the office, and we can either have a phone chat, or if they're looking for presentations, we can probably set something up online. I know they're trying to do a lot of the naloxone training presentations online right now. So
we'll definitely link to all of those on this post, as well as more information about the fund, other organizations that are funded by this response fund. If you'd like to learn anything additional, check out those websites and social media online, or contact us directly.
I think that's great. Thank you, Aisley, for joining us today, and thank you, Sean. And Yeah, I think I just wanted to end with one. If someone is out there and they need help, or they are worried about somebody overdosing, Aisley, what is the best number to call?
It's 403-346-8858. That's our main office line, and then from there we can best direct you. So
Awesome.
yeah.
Right.
And I just wanted to thank you for having me on here. I really appreciate it.
No, thank you for your time, Aisley. Yeah.
Yeah.
Okay, so yeah, thank you again, and keep an eye out for next week's episode with a different community agency.